Welcome everybody to this session. Courtney is going to present her mid-candidature presentation. So it's all yours now, Courtney.
Hi everyone, and thanks for coming today. I'll be presenting my mid-candidature review today on the clinical application of text messaging for anxiety and depression. So first I will briefly discuss the background and rationale for this research. Then I'll present the findings from a systematic review and pilot study and describe how these findings will inform my third study, a waitlist randomized controlled trial. There is a growing need for effective and accessible mental health treatments in Australia and worldwide. Mental illness is a significant contributor to the burden of disease and is a leading cause of disability, in part due to the large treatment gaps that exist. Before 2020, 1 in 5 Australians had a mental illness in any 1 year. However, it was estimated that only 35% of these people access services. This need has rapidly increased due to the COVID-19 pandemic and the associated socioeconomic implications. The demand placed on the mental health care system is further widening the treatment gap. Since March 2020, the Australian Psychological Society have reported that 88% of psychologist wait times have increased, and over half of waitlists are at least 3 months long. An alternative approach to treatment is needed to overcome the numerous barriers that contribute to this gap in treatment access. Mobile health, a subset of telemedicine, is a potential solution to this problem. Recent evidence is accumulating that demonstrates delivering healthcare via mobile phone is effective at improving health outcomes, including mental health and treatment efficacy. Mobile phone use is extremely prevalent globally, and text messaging is the most popular way of communicating amongst mobile phone users. Text messaging can reach large numbers of people immediately and increase access to services for people regardless of geographical location and socioeconomic status. The research shows that text messaging has been used in the mental health domain to increase therapy session attendance, improve medication adherence, monitor symptoms, enhance treatment outcomes, ensure continuity of care, overcome barriers such as forgetting to attend appointments or geographical location, and increase satisfaction with services. As phones are generally always kept on the person, this method of communicating can assist people to incorporate their treatment into their day-to-day lives. Research into the effect of using text messaging to deliver mental health interventions is in its infancy, and there are a lack of high-quality, large-scale randomized trials. My research aims to address this gap and test the effectiveness of a text messaging intervention in a clinical mental health setting. This will involve 3 studies: a systematic review, a pilot study. Both have been completed, and their findings will inform a randomized control trial where a text messaging intervention will serve as an adjunct to face-to-face treatment. The systematic review looked at the current evidence for studies that deliver text messaging interventions to treat mental illnesses. There were 4 main aims of the review. Firstly, to provide an updated review of text messaging interventions in the treatment of mental illnesses. Secondly, to understand the impact of text messaging interventions that deliver psychological content to clinical populations. Thirdly, to explore the impact of text message characteristics on outcomes, for example, individualized or one-way messages. And lastly, to use the findings from previous data to inform the design of an RCT. 5 databases were searched in October 2020. Included studies needed to be in English. Participants needed to have a diagnosis of mental illness or symptoms meeting clinical levels of a validated measure. The intervention needed to use text messaging to deliver psychological content. The effect of text messaging needed to be identified, and mental health symptoms needed to be the primary outcome. Studies were excluded if they only used medication adherence as an intervention aim and outcome, if no empirical study was conducted, if the effect of text messaging could not be identified, and if studies used appointment and medication reminders only. The study was registered with Prospero, and the program Distiller SR, which uses AI technology, was used to screen articles and extract data. 2,605 articles were identified from a search of the databases. After duplicate removal and title and abstract screening, 241 articles had their full text screened. A final sample of 47 studies were identified by 2 reviewers. 64% of the 47 studies included in the review were randomized control trials. 38% of all studies were pilot, feasibility, or proof of concept studies. Studies were published from 2006 to 2020, and 70% of the studies were published after 2016, indicating the recent growth of this area of research. Only one of these studies was from Australia, with nearly half from the USA. This review included 4,701 participants in total. The average number of participants per study was 56, and sample sizes range from 5 to 1,139. The average age of participants was almost 39, and 7 studies included adolescents. 4 studies recruited female participants only. Across the 47 studies, intervention duration ranged from 3 days to 12 months. As you can see here, 3 months was the most frequent duration. Frequency of text message delivery ranged from once weekly to 12 messages 6 times per week. In a third of studies, the frequency of message delivery was determined by the participant. Half of all studies included utilised a text messaging only intervention. The other studies used a range of adjunct interventions that included phone support, education sessions, individual or group therapy, outpatient service, access to an app, and unspecified treatment as usual. Studies were only included if the impact of text messaging alone could be identified, though. 54% of studies utilised one-way text messages. That is, participants could not respond to the messages. Significant findings were reported for each type. Individualised and standardised messages were almost evenly split across the studies. 2 studies compared standardised messages, that is, where messages are all the same, to messages individualised to the participant. In one study, there was no difference found between the 2 types, and in the other study, the standardised messages were found to be more effective. Seven themes of message content were identified across studies. There were supportive messages, motivational messages, symptom monitoring, psychoeducational, instructional, messages that delivered psychological interventions, including ACT, CBT, mindfulness, motivational interviewing, and nudges for these psychological interventions, for example, reminders to practice skills. Some message content was determined individually by each therapist within the study. These 2 charts show the proportion of diagnosis by study and by sample size. In both, depression had the largest proportion, with general mental illness and schizophrenia having relatively large sample sizes, but few studies. Substance use and anxiety had the next largest number of studies after depression, but they had small sample sizes. Anxiety and depression together make up about 50% of the number of studies included. Types of outcomes reported included symptoms, behaviours such as drug use, whether diagnostic criteria were met following the intervention, and if there were changes in hospitalisation or service use. This slide demonstrates the proportion of studies that reported any significant result in blue. We can see that, judging by descriptive data only, Text messaging interventions resulted in a large proportion of significant outcomes for depression, anxiety, schizophrenia, and general mental illness. Effect sizes will be calculated in later analyses. Study 2 was a pilot study that aimed to determine the usefulness, understandability, and ease of implementation of text message content. This study will inform the intervention and logistics, such as frequency, for a text messaging randomized control trial. A pool of 48 text messages were developed with a team of psychologists and psychology researchers, which were then presented in a Qualtrics survey. Australian and American participants were recruited to provide their opinions on the barriers to mindfulness, logistic preferences, and opinions on the usefulness, understandability, and ease of implementation of a subset of text messages. The text messages developed for the pilot study were designed to target 6 mechanisms or processes of change. These are affect, attention, cognition, motivation, overt behavior, and self. A psychological flexibility framework was used to target these 6 areas. Psychological flexibility can be described as persisting in action or changing behavior in the service of values. The 48 text messages fell into 9 categories. There were 5 mindfulness categories based on the 5-factor mindfulness questionnaire: non-attachment, ways to well-being, self-compassion, and observing self, or self as context. These 9 categories map onto the 6 processes of change as seen in this diagram. All messages were intended to have a values component designed to target the motivational process. The pilot study had 296 participants, with 200 from the USA. Over half of all participants were female, and half were aged under 35. 51% of the sample had previous experience using mindfulness, and forgetting and not knowing how were the most common reasons participants gave as barriers to practicing mindfulness. Participants were presented with a message and asked, how useful is this message on a scale of 1 to 5, with 5 being most useful. All messages had an average rating between moderately and very useful. Aware actions messages were found to be most useful, with non-attachment messages considered least useful. This graph demonstrates the means and error bars for the usefulness of each message type. As you can see, there was overlap between all message types, indicating no significant differences across usefulness ratings. The most useful message was a non-reactivity message. When we have strong emotions like anger or anxiety, we feel like we have to react, but we can also slow down and choose our response. The least useful message was a non-attachment message. Like sunny days, pleasant experiences don't last forever. Can you let pleasant experiences go when it is their time to go? Participants were next asked, how understandable is this message, from 1 to 5, with 5 being most understandable. No individual message was found to be difficult to understand. Aware actions messages were again most understandable, and observing self messages least understandable. The graph here demonstrates that there are significant differences between the understandability of observing self messages compared with aware actions, describing, non-reactivity, and self-compassion messages. The most understandable message was an observing message. Take a moment during your busy day to pause and observe what is around you. Embrace your life as it is. The least understandable message was an observing self message. We all experience self-criticism. Notice how you can observe yourself being critical. So there is a part of you that is an observer, that sees the criticism. This means that you are not just your self-criticism, you are more than your thoughts. Next time you're struggling with self-criticism, see if you can step back and observe yourself. Remind yourself, this criticism will come and go. It does not define me. Participants were asked for each message, how well could you implement this message during your day? Observing messages were considered the most implementable, with non-attachment messages least. There was marginal overlap between non-attachment messages and ways to well-being messages, with the other message types not significantly different from each other in terms of their implementation. The message considered easiest to implement was a non-judging message. Negative emotions are a normal part of human experience. They do not make you weak or broken. They make you human and alive. Let feelings come and go. The least implementable message was the same as the least useful message. Like sunny days, pleasant experiences don't last forever. Can you let pleasant experiences go when it is their time to go? There were a few interesting findings from the analyses of individual messages. This non-attachment message, positive feelings come and go. For example, sometimes we are the center of attention and feeling proud. Sometimes we are in the background and feeling invisible. Can you notice a tendency to cling to positive emotions, wanting them to repeat or wanting them to last longer than they typically do? Was considered very useful, but participants were not sure how to action the message, as seen from its low implementation rating. This waste well-being message, think about someone you care about and value. How would you like to connect with them today? Was found to be easy to implement into daily life, but not useful. Messages that were rated as least useful and implementable often did not have a clear values component. That is, a reason why a person would choose to act on the message prompt. This observing message, feel your feet on the ground, firmly planted on the earth, does not motivate or provide a rationale for the recipient to do the activity. The systematic review from Study 1 showed how variable frequency and timing of messages is across studies. The pilot study results showed that participants preferred daily messages, and they preferred that these messages were received in the morning. The results from the systematic review and pilot study will inform the third study, weightless randomized control trial, in the following ways. Firstly, there is a need for larger scale RCTs in text messaging for mental health. Text messaging interventions are effective across a range of mental illnesses. Frequency and timing preferences were determined from the pilot study. Messages that were poorly rated will be reworded to include a values component or removed. Standardized and one-way messages are effective while also being more efficient. No study yet has used text messaging to specifically target processes of change. And all 9 types of messages assessed were generally considered useful, understandable, and easy enough to implement. The randomized control trial that I'll conduct next will test the effectiveness of a text messaging intervention in a clinical population with a waitlist control group. Here is an outline of my timeline from this year. I'm currently here at my mid-candidature review and will next be developing and rolling out my randomized control trial. However, the start date for that is dependent on ethics approval, which was first submitted in September last year. Thank you for listening. Do you have any questions for me?